Gone are those days when doctors were the only people who knew about diseases. The statement is true not only for simple flu but also for complex cancer. In the present time, diseases exist beyond the big fat medicine books. With all the knowledge explosion on us by the media, all the awareness campaigns by the governments, people are more than just aware of the diseases that exist for real. But all of this awareness and knowledge, does it really have a role to play? Are we, the so called city people, considering getting ourselves screened and checked regularly? No, unless, of course, we have visible symptoms which are hampering our lives. The reason behind all this is that there is so much knowledge around us these days, which is almost always incomplete, that it started to give us all a false sense of security. We think we know if we'll have cancer because we'll all have common symptoms like sudden unexplained weight loss, voice changes, or a non healing wound or ulcer. Such assumptions are ridiculous because most of the cancers do not even present with any symptoms at all before they reach the end stages, when of course it's too late. The reality of a disease like cancer is so much different when we and our loved ones are far away than it is when we are slightly near it. And then there is very little that we can do to help us and others. We think if only I knew better. Well, we can all know better. The only thing we can do to make it better is to equip ourselves with knowledge regardless of our profession and stand in the society. This alone can help us play our roles better. Yes, we all have some role to play. There were days when cancer was a dreadful disease to everyone. Not that it isn't now, but the scenario has changed. It's become common knowledge to all that smoking causes cancer, but how many people actually stop smoking? Because it has become a common thing, we see and hear all about people around us dying with cancer, we feel sorry and then we sleep it out. Those days are long gone when we could just sit in our homes and wait for the people in the labs to come up with one magical cure for cancer. Surely hope is a good thing to have, but again, faith without actions is dead. So, as I said, everyone has a role to play. Researchers are studying cancer, its behavior, and are trying to find a cure. Pharma companies are trying to come up with effective drugs and lessen the side effects. Doctors and surgeons stay updated with all of the recent cures and help the patients get better. Nurses try to make their patients feel more comfortable and help them ease the pain. The physical therapists help the patients to go back to their normal lives once the nightmare is over. But that's not it. How many of us are actually trying to prevent it? I know it's something beyond our control, but we all have the knowledge and resources. Are we utilizing those to the fullest? I think we all know the answer to that. So, who can prevent it? Well, we all can. And can anybody do it for us? No. So, how do we prevent it? Let's take a look. First of all, we all need to change our perspective and indifference towards cancer. It's very common now, but does that make it kill less people? No, only more. So, should we just feel sorry for those affected and go back to work? Not at all. We should put in effort and find our risks, even though we consider ourselves very, very healthy. Secondly, creating awareness regarding cancer should not be a yearly event but a continuous process. This will filter out thousands with risk as opposed to 5 or 6 in a yearly campaign. Thirdly, the risk factors should be minimized for all of the population. For example, complete prohibition of tobacco, and especially for those who are at high risk, for example, administering tamoxifen to women with high risk of breast and ovarian cancer, or even considering an option of mastectomy. Finally, efficient record keeping should be done of individuals with cancer. Record of one individual who was diagnosed will show the probability of it developing in at least 3 to 4 other individuals who are blood relatives. For example, a woman who was diagnosed with breast cancer has 2 daughters and a sister. This should be recorded, and their chances of developing cancer should be evaluated. They should be educated about the risk factors in regular screening and so on. What is the one thing we know for sure about cancer? We know for sure that it's a disease with strong genetic predisposal. And we know that this genetic trait can be passed on to the offspring and can be found in other blood relatives as well. So let's utilize this knowledge to our benefit and the greater benefit of the society overall. Stay healthy.